Welcome, everybody. I'm Maxime Dawson, a homeopath with Switch on Health, and I'm going to introduce to you today the homeopathic remedy Arnica montana. Its most common Latin name is leopard's bane, and as you can see here, it is a flower, and it is yellowy orange in colour. Okay, so Arnica montana, we just refer to it as Arnica, is a perennial herb, and it grows in mountainous regions, Canada, States, Siberia, Asia, and Europe. It's a perennial, and that means that it has a life cycle of longer than 2 years, and it grows from its root system. So it's not an annual that just is seasonal. Okay. So other names for Arnica is wolf's bane, bruisewort because of its affinity to bruises, fall herb because its affinity to falls, and mountain tobacco. And it's been used as a herbal tincture. It goes way back to the 15th century. And there you can see Arnica growing in a mountainous region because that's what it likes the best. It likes the Alps. And yep, there it is. All right, historical uses of Arnica. So traditionally, Arnica has been used by herbalists for over 500 years, and they used it in herbal form, poultices, and just herbal tinctures. And they would apply it topically to the skin because the flower itself is actually poisonous, so it's not something you take internally, except in homeopathic form. So the historical uses of Arnica, it's great for inflammation. It encourages blood flow around the body. It is actually a blood remedy. When I think of Arnica, I think of it as a blood remedy. It helps blood circulate, stops it pooling or stagnating, and in the blood circulation, obviously, it delivers oxygen to the muscles, and it has a great affinity for the muscles. So very good for that. They used it for sprains and bruises, and we also use it for that. Any kind of inflammation, it's great for. Any kind of surgery as well. They used it, and we use it post-surgically, and for arthritic flare-ups, also very good. Okay, so they applied it topically in creams, ointments, lotions, and you can get, creams, oils, hydrogels today, as well as homeopathically, we take it internally, either in pill form or liquid form. Okay, I think we've covered this, that it's for sprains, strains, bruises, very good for chilblains. There is a contraindication that Arnica should not be applied to broken skin. So if the skin's broken, we don't apply Arnica. We apply it to bruises where the skin is intact. For torn or lacerated skin, you can apply calendula in its tincture form, and that's very good for wound healing. Apply it topically. Okay, causations. So when do we use Arnica? What's the causative factor that we would think of Arnica? And probably the chief one is mechanical injuries. So any kind of injury to the body, whether that's from overexertion, that can also cause injury if you overexert a muscle or an organ. Very good post-surgical operations to encourage wound healing and recovery. It's also a good remedy for shock. So any fear or fright or mental condition that's brought about shock, which could be financial loss. Excellent shock remedy, really helps someone move through shock. Anger, that was in the materia medica, so you might not always find that your patients are angry, but it is there if they are exhibiting that symptom. Very good for splinters, very good for insect stings and bites. You can also compare it to ledum, which is very good for insect bites. So, in your comparison of remedies, think of ledum for insect bites, but also Arnica can be very useful. Okay, strange, rare, and peculiar, SRP symptoms. So these are symptoms that you wouldn't think are directly linked to your patient's condition, and are keynotes in prescribing a remedy. So if any one of these symptoms comes up, you would immediately think of arnica. One of them is the bed feels too hard or is full of lumps. And the reason for this is that their body is battered or bruised, or they feel battered, and they can't get comfortable, and they're just not comfortable, and they're tossing and turning about. So the bed feels too hard. Baptista, as I've got in brackets, is another remedy that they say the bed feels too hard, and there's a lot of heaviness and soreness in the muscles. So compare Baptista just to make sure you've got the right remedy. And also Baptista, they fall asleep mid-sentence. So you do need to do your comparisons. With arnica, there's a streamlined version for tobacco, and they say there's nothing wrong with them, and clearly there's something wrong with them. They say there's nothing wrong with them, and you can see that there is. So that's a very clear indication for using arnica and a strange, rare, and peculiar symptom. Okay, so here you remember the fairy tale, The Princess and the Pea, that she slept with many mattresses but could feel that tiny little pea under all those mattresses. And perhaps you'll think of arnica when you see this image, because arnica, like that, they can't get comfortable in bed. The bed's too hard, the bed's too lumpy, and they're moving around continuously, but sometimes that movement isn't actually beneficial to helping them. All right, indications for using arnica. Well, arnica it's an acute remedy, so it's to be used in first aid situations most of the time. Any accident, any trauma, it's got a big affinity for trauma. So any accidents, injuries, shocks, falls, contusions, which is just basically bruising, bed sores, or any concussion to the head, think of arnica and give that remedy first. Okay, more indications for arnica: blows to the head or body, any kind of blow. They will exhibit great prostration. They will want to lie down. They will be fatigued. I've already said it's good for surgery, and that includes dental surgery. Again, give it post-surgery to help with wound healing and recovery, get that blood circulating. Also, arnica can be seen in low septic conditions. So where I've got in brackets LSC, that stands for low septic conditions. So they'll have some foul-smelling discharges, their breath, their stool, their flatus, and you might also see some abscesses. Drops of small boils, definitely a big, strong indicating symptom to give arnica. And I can tell you from my own experience, when I was studying homeopathy, I came out in a crop of small boils underneath my breast. And I didn't know the remedy well enough the remedies, I didn't know them so well to know that was my body calling out for arnica. So I went to the doctor, and he didn't really know what to do with me, and he sent me home, and they healed eventually. But really, arnica would have been excellent for treating that. And it's also very good prophylactic for pus formation. So think of arnica in that instance as well. Okay, more indications. Anything to do with the muscles and tendons, arnica's excellent. And you'll see a lot of back pain with arnica. I've treated so much back pain. I've treated a child with a scoliosis who did need surgery in the end, but it definitely helped with the pain. So yeah, lots of back pain with arnica. Also, you may or may not see, but just to think of it, and it's in the Materia Medica, vaginitis in women from excess overindulgence, and impotence in males from excess sexual overindulgence. But where you see that overindulgence and excess, please also compare it with the remedy nux vomica, just to make sure you get the right prescription. So lots of pain with someone needing arnica, pain all over the body very sensitive. They can't get comfortable, and they're moving around to get relief from the pain. For it, and compare with Rhus tox, because Rhus tox also experience pain and stiffness, and they need to move. And once they start moving that body part around, it gets better. But with arnica, that's not always the case. All right, mental, emotional. So I mentioned that it's very good for shock or any kind of trauma. So I would definitely think about giving arnica then. They could be overworked or exhausted. Now, NBW is never been well since. So maybe you have a patient come to you and they are telling you that they've had these symptoms, and it traces back to some trauma they had or shock or grief, and they haven't recovered since. And that could have been sometime in the past. So please think of arnica. And again, mental trauma that leaves some chronic mental or emotional effects. Arnica is very good for that. There's nervousness to them. They'll be very nervous about you coming anywhere near them or touching them. They'll be protecting their sore limb or their head, and they feel very sensitive, and they don't want you to come anywhere near them, and they don't want you to touch them. So that is another key indicating symptom for arnica. Very good for any kind of head injury, can be given to stroke victims where their mental functions have been affected. With head injury, there is, as I said, arnica is an acute remedy. There is a deeper remedy, and in brackets I've got compare Nat Sulph, because Nat Sulph is a much deeper remedy for head injuries and concussions. I would still give arnica for as long as, until perhaps arnica isn't holding, or there's some other symptoms, and then you would look at Nat Sulph. We've already said they fall asleep mid-sentence when delirious. They can get depression from injuries to their head. Again, compare Nat Sulph. And they're forgetful and forgets the words that they're about to use. And that could be indicative of some kind of, brain trauma. And arnica can be useful, but you may need other remedies as well. Wants to be left alone, doesn't want to be touched. Very good if they've been unconscious and they've got a concussion, arnica can help. And again, they said there's nothing the matter with them in serious cases, when clearly you can see there is, and they don't want you to call the doctor, and they'll send the doctor away. But really, there is something the matter with them. So that's a key indicator for arnica. Okay, modalities. So the arnica patient will feel better when they're lying down outstretched, and they like their head low. They don't want to be sitting up. They feel better for motion, but it doesn't always help their condition. And they like clear, cold, stimulating weather. They are worse for the least touch. We've already mentioned that. They don't want anyone to approach them. They're worse for movement. Obviously, they're worse for injuries, falls, blows, bruises, and shock. And arnica is a very good remedy to give during and after childbirth. And I could tell you a story that when I had my first child and I was studying homeopathy, arnica was the only remedy I used. Since then, I have worked as a homeopathic doula for other labouring women, and there's a lot of other remedies you can use. But in my case, for this first pregnancy, all I used was arnica, and I was taking that. I took that quite a few times during the birth. I was in a lot of pain, and and it was a difficult birth, and my baby was a failed fontus when they put a big suction cap on their head, and then that failed and that popped off her head, and then they went in with forceps and they brought her out, and I was very bruised, so I kept taking arnica afterwards. But the thing with the baby, my baby, when she was born, so she was born with this great big black, it was about that big on the crown of her head. It was horrendous. So, well, she wasn't born with it. It was red, but a couple of days later or the next day, it came out as a really black bruise. And I remember the nurses commenting that I was really lucky that the skin hadn't broken. And I attribute that to arnica, all that arnica I took in the pregnancy. Not in the pregnancy, in the labour. And also I then applied arnica cream to the top of her head where that bruise was, and it cleared up really quickly. So I am a big fan of arnica for childbirth, during and after. More modalities, arnica is worse for overexertion. Lying on the left side, that's a key indicator. So it doesn't matter which side that they have been injured on, but lying on the left side will point you towards arnica. They don't like the damp or cold. They're worse for motion, worse for sprains, worse for rest. Remember, they want to move around, worse for alcohol, and they're worse after sleep. So there's another remedy that is worse after sleep, and that is lachesis. They wake up unrested from sleep. So bear that in mind when we're prescribing remedies and make your comparisons.